So week 3, as I said, we're going to do school age and we're going to do adolescent. Remember, next week is your exam. This week is full of reviews. There's one tonight at 8 o'clock. There's one tomorrow at, oh, what time is that one tomorrow? They're all this week, every single day. So remember, I do post them as soon as I get them so that you will have them there to do. I suggest at least listen to 2, if not 3 of them. There are 7 professors, okay? I do know Professor Arstenstall went really long, so in detail. So, it's I'm just warning
We
you,
were
it's a
there till like
longer.
almost midnight on hers. That
I
was
saw that. Quarter to 12 from 9:15. I think she retaught you everything. So my review was what, Marie? A minute, 1 hour 15, 1 hour and 10. It wasn't that bad. I take for granted that you have already learned a little bit. So anyway, as a refresher, but if you need that detailed instruction, there you got it, right? It's going to be there. Yeah, I saw that you were there, Christina. Thank you. And I know she appreciates teaching to somebody. So, keeping there all that time shows a lot of determination.
So
Next
this
week,
um
yes,
PowerPoint, I didn't mean to interrupt,
it's okay.
but the PowerPoint that you had put up, like what we see, like basically when we be using like the flat scale and stuff like that, like what you would see, was that for the review or that was just for like a regular chapter?
I sent you the study guide PowerPoint, and then I sent you this week's PowerPoint.
Okay.
Frederica, which one are you talking about?
This the one.
What does it say?
It's a what we may see in the baby grimacing in the front, like the baby in pain, using a flat scale, you're looking at their face and stuff.
Uh-huh.
So is that for the review or that was just for a regular chapter?
That is part of the review. You're gonna have to know FLAC and FACES scale.
Yeah.
Pain is
Okay.
a big thing in nursing today, and it's something that the Joint Commission came out about in the early 2000s. And let me tell you, they're really, really keen on making sure that every hospital has a plan in order to take care of pain. Children have been, not looked at as closely because kids don't complain, right? They don't know they can complain. Adults do. So they're making sure it's there. And there's all these different programs. I remember one that I had was called PI, and it had to do with pain, an intervention, and an evaluation. And the name of the program was called PI. And that's what it was all about. And it just showed that we were addressing the pain, and we had certain criteria that were involved in that. So pain is a really important part, Frederica. So let's go ahead, let's get our PowerPoint started. Again, I always attach these to the announcement with that week's information. I also, we're going to apply it to when I do the recording, just to make sure that you can see it. I know initially I was getting a lot of questions. Where is the PowerPoint? I can't find it. Well, you have it in 2 places. So you have it there. So here we go, school-age children. School-age children are from ages 6 to 12. It's a long period of time. It's 6 years. So it starts with at 6 years old, you start seeing those deciduous or baby teeth start coming out, falling out, and the tooth fairy has to come, right? Now, school age ends with all of your permanent teeth in. I'm not saying those wisdom molars, that's something different, but all your primary teeth are in, and it's the beginning of puberty. So we've gone from the baby-faced child of that kindergartner at 6 years old, all the way up to almost an adolescent. So it is a lot of growth and development, but over 6 years, it's very, very slow. So it's gradual. Now, the one thing we need to remember about school-age children, many of them look older than they are. You'll see younger girls that have breasts and curves, and you just think they're older, and you tend to talk to them like they're older. Remember, you've got to figure out where are they mentally, developmentally. Their age doesn't always express where they are mentally. So always make sure you do that before you're explaining procedures, etc. As I said, growth is going to be, gradual, but look at this. Total height that you gain is 1 to 2 feet in these 6 years, okay? Your weight doubles from 6 to 12. So there's a lot of growth, but it's over 6 years. And at this point, until we get into those adolescent, pre-adolescent, go through puberty, boys and girls, there's no difference in their sizes. I know all of a sudden the boys were really tall, and into elementary, middle school, they were the same height as me. Now, the other thing that starts to go on is they get to be more graceful. They start losing those baby fats, and their muscles and bones become stronger. Their head has nothing to do with their height or their chest or anything like that. And we know their faces are going to change from that little baby face of my little Christian at 6 years old. I don't want him to be 12 years old and turn into a little man, but it's going to happen, and I'm going to see it happen slowly. And again, as I said, it's the age of all I want for Christmas is my 2 front teeth, right? Because their teeth are going to be falling out. Now, we've talked about the body and the body systems and the immaturity of the infant and their GI tract, why they can't have foods. Well, let's go on up into school age. Your body's becoming more mature, it's becoming more efficient. So your bladder is bigger, which means road trips are a lot easier with your school age children. The heart, which took up a lot of that chest, is now smaller in relationship to the body. Children have had multiples of viruses, colds, earaches, whatever. So their immune systems are getting really strong, and their bones now are starting to ossify. They can crack easier as they get older. The younger kids were more soft, remember? And as I said, physical maturity has nothing to do with emotional or social maturity. Just because they look like they're older or they should be, they're not. So just remember that. One of the things we need to remember about school age children, if you start seeing them all of a sudden acting different, acting out, not handing in homework, doing things that they weren't supposed to do, this could be a sign of stress that's going on at home. It could be mom and dad breaking up, somebody lost a job, the cat got lost, could be the addition of a new child in the house. All these things can show stress or distress on a school age child. So you're going to start seeing things. Maybe they overeat, maybe they undereat, maybe they're sleeping too much, or they're acting out. All those things could happen. Now at the end of school age, it starts that prepubescent stage that we talk about. And it's different in all different children, but usually prepubescence is between 9 to 12. And we know it takes about 2 years before it starts to go into that puberty, right? That you start seeing the more of it. Now, puberty is 10 in girls and 12 in boys. That's why when you're in 5th grade, you're 10 years old and you still think boys are stupid because they haven't really, emotionally evolved yet. And I remember thinking, why is he so dumb? And then of course, the next year you're thinking, I think he's cute. But at that age, you still are thinking those things. Now, how do you assess children? Well, again, how old are they? Right? 6 to 12, it's a big thing. Now, a 6-year-old, you might have to say, well, I'm going to send you for an x-ray to look at, see if your arm's broken. And I'm going to send you to the radiology department. And they might look at you and go, oh, what does that mean? Right? And especially get to that x-ray department. Have you ever heard them go click, click, click as they move this big machine over your head or put it up to your chest? It's really scary. So if we tell them it's just a really big camera, it's not going to touch you. There's no x-ray radiation coming out to zap you. But all of a sudden, we'll see the pictures of your inside. That kid's going to go and they're not going to be as scared because they will be. The other thing that I put into my practice is I always show the child the x-ray. I was lucky to have that ability in all of my rooms where the children were. So I could show them a broken bone or I could show them a pneumonia. And that really helps them make themselves better because they can see the physical. They need to see it to understand, right? It's concrete. They can see it. You're going to inspect, look at the kid. What does he look like? You're going to auscultate, listen to everything. You're going to pertuss to see if there's any liquid or things in there, and then palpate it, any masses going on. Lymph nodes, you should not be able to feel them. And if you do, that child is usually sick. Assessing their hypoglossal nerve, you know, those cranial nerves like you learn in health assessment. Well, how do you do the hypoglossal nerve on any person? You stick their tongue out. Even infants will do that for you because they love to imitate, right? You can see them a little bit. And I always like to do that to the parents, like, why are they doing that? And they look at me and go, okay. Another thing we have to remember is, especially the younger children, they have a shorter neck and they're always full of mucus in their upper airway. It's just part of their being. And if you listen to the lungs, you might hear noise. Now, is it referred from the upper airway or is it upper airway mucus? So you do bronchial breath sounds and you put the stethoscope, you know, right there at the trachea in between the clavicles, right there. And you can listen. And what you hear is usually that upper airway. And of course, if you want the fascicular, it's, you know, lower. And now you can delineate, is it upper airway or is it real breath sounds? Now, Freud, you know, you're going to see theorists on this exam. Absolutely. Freud, what does Freud talk about? Well, his whole thing is all about same-sex peers. You know, sexuality is talking to another peer about, you know, your life. Because remember, these kids are breaking away from their family. There's more time away from the culture of the family. So they're learning other things. So those relationships are same sex. Now, Erickson. Erickson likes to talk about industry. And industry is something a child does well. Are they good at math? Are they good at spelling? Are they good in sports? You know, every child is good at something and they really feel a sense of accomplishment and feel really good about that. But what happens? Those other stuff they can't do. I mean, usually you have the kid who's good at schoolwork and not good at, you know, in PE or gym or whatever, right? They can't. So they feel a sense of inferiority. That's part of Erickson. Industry, what I can do well. It makes you feel good. And it also makes other people notice how good you are at that. And you're admired for it. But the inferiority is stuff they can't do and they don't feel good about it. But everybody can't do everything well, right? Now, Piaget. Piaget is now more concrete stuff going on in the head. You know, understanding past events and things and applying it to now. Now, one of the things that we talk about, and I hate the word and I hate the way it's said, masters of conservation. Well, what is that? Well, there's a picture. Now, it's next, but it shows a glass, one small, one fat and tall. Now, this glass of water, I'm going to put in the other glass of water, and one's going to look taller and skinnier and more. One's going to look shorter and fatter and less. School-age children understand it's the same quantity. Younger kids don't get that yet. Or take a bunch of pennies and take and spread them all over. Now, there's still 10 pennies there, but they're all over the place in a different pattern. School-age children can recognize that. Your younger kids cannot. So this is what they talk about now, understanding and recognizing those sort of things. Why they call it conservation, it's just what they call it. Now, all right, I did that. Now, formal operations is the end. It's the end, and actually, it's actually adolescence. You know, they say it's ages 11 to 12. What is it? Now, this is what they say, a systematically way to solve a problem in a logical, methodical way. Well, what does that mean? Well, ever be a teenager and your mom said you can't go to the movies this Saturday with your friends because of whatever reason? And you're thinking, well, I really want to go to the movies. It's either how am I going to sneak out of the house or how am I going to do stuff to please mom and dad to say, you've been so great this week that we're going to let you go. All of a sudden, the garbage is out, the dishes are done, your bed is made, your clothes are put away, you get an A on the exam, and mom says, you know, you did all that good stuff, I'm going to let you go. That's logical and methodical. They figured out a way to get what they wanted. And adolescents, those late school age children, are really good at it. They really are. They make mom and dad feel guilty if they don't let them go. Now, Kohlberg, we know the younger kid is more about good and bad and a consequence for each, which means I can get good consequence, I get a bad consequence. But what Kohlberg says in the school age children is they're pleasers. They want to do stuff to please. They know that there's wrong things, but doing the wrong thing because of a bad consequence is not why they don't do it. They don't do it because they want to please and they don't want to look bad. They like to please. They want to be a good kid. That is school age. I mean, I take the example of one of my kids coming home from middle school and they had to cross the street and there was a 7-Eleven there and many of them would stop and a lot of kids would steal candy and my kids would tell me about it. And I'm like, well, why didn't you? They said, well, you would beat the out of us. So there's no way if we found you found out about it, we didn't want that punishment. So again, it was part because of the punishment, but most of all, they wanted the good things. They wanted me to be there when we wanted to do all the other good stuff together. Spiritual development. Now, this is where the children understand whatever the culture of the family is. They're starting to get it and understand it, and they have a real big thirst. You know, Christian asked me the other day, he says, so Jesus walked on water. So how can I walk on water? Can you teach me? Can Jesus teach me? And I'm like, wow, now where do I go with that? So now we have to, let him understand, that aspect of God. This is what he understood. I said, where did you find that? He goes, on YouTube. He's a little YouTuber. He likes to go and find how to play games and, Winky Bach and who knows what all's out there. But he loves to learn and see and imagine and be creative. But he also learned about Jesus walking on water. Go figure. Now, another thing is they're starting to think that if they do something bad's going to happen to them. The one way I seen this a lot in my career was in the emergency room, little kids coming in the school age area, having an appendicitis and needing surgery. They come in, they have bad pain, and they know they're going to surgery. And you see them worried, their shoulders are slumped, they just don't, feel good. Well, they hurt too. But you know what I used to do with these kids? I sit next to them and I say, listen, you have this appendix in your body and it really doesn't do anything. And for some reason, there's no reason why. It's nothing you did bad or wrong to your sister or because you didn't do good on that test. It's just, it didn't want to be there anymore. So we're going to take it out and it won't bother you anymore. So now I've alleviated the fear that God is punishing them, right? Because God could make them die too. And they're into death too, thinking about those things. And then I say, and I'll make sure the surgeon puts an extra stitch so that your insides don't come swelling out. Those shoulders, all of a sudden, they, actually feel better because I sent them to surgery with a different mindset. Most nurses don't think about that. But for a child, it is really real. Peers, very important. Same-sex peers. This is all about Freud, what he says, very important. And as your discussion question says, sometimes they'll go and do somebody else's sport, their peer, that's their best peer, just because they want to stay with them because that's what they know. They're pleasers, right? So sometimes they will play soccer instead of softball or vice versa because their peers wants to be there. And they really are influenced by that. And at this point, it's still same sex. They are starting to join clubs, peer groups, brownies, Girl Scouts, 4-H. They're getting into soccer, gymnastics, whatever, dance. They're starting to get a part of it. Now, we know that this time away, there's another adult guiding these children most of the time. So again, they're learning how to follow the rules of somebody else. But these people must be people that are going to have a positive influence on them, not always telling them, no, do it again, wrong, that's not good, do it again, right? We don't want to hear that. We want to say, that was good, but let's try a little bit more. Let's try it again. Those things are important. And again, parents must be parents, not their friends, because they still need to be there to catch them because there are all of these influences. And any club will have bullies. I'm better than you are. I could do that and you can, or I have this and you don't. It's just part of, children and what they do. Now play. I mean, we all play somehow, some way. I've got my little word game I play almost every day. I think it keeps my mind fresh, or that's my excuse. But play is very important, and it does help them learn rules, rituals, how to work together or alone, and it makes you feel good about yourself. Whether it's playing the piano, as a 10-year-old, I was really good at tap and ballet. I used to have my own little solos. I was so good. And it made me feel good about me because I was called out to do it separately. So it made me feel good. And the older kids looked at this younger kid doing it and said, wow, look at her, right? And the audience, oh, look at the little one up there. And that was me. Self-concept is very important. They need to know what they can do, how they can do. And now they're starting to look about their appearance. That the colors match and that their hair is combed, or maybe, girls want that special ribbons or hair things and have mommy buy it for them. Those are really important. It does develop that self-confidence and makes them feel happy about themselves. Body image, as I said, as they get older, they're starting to realize the flaws in their body. We do know that children do look at eye color. They see that a lot: blue eyes, green eyes, brown eyes. And they're starting to see all the differences in children, different cultures, glasses, braces, hearing aids, all of these things. It's all part of understanding the differences in people and their body. Now, when they are young, in the beginning of their school age period, they have started with preschool, and it's more fun, and you take a nap and it's less time. And then all of a sudden they're in kindergarten. And in kindergarten, there's certain things that they need to do. They have to sit down, they have to be able to get along with another teacher and to get along with other kids, and to be able to pay attention for a certain period of time. Very important that they do those things. And remember, now the kid's pulling away from your home. They were only in daycare, play, whatever. Now they're in a structured environment. And again, more time away from home, other influences, other cultures that are, affecting your children in one way or another. They're making their eyes go, this one's different, and they do that. And why, mommy? Why, daddy? Why does that go on? Nutrition. Can I say it enough? I mean, nutrition is one of the most important things that to fuel the body. We know that children today usually have parents, two of them if you're lucky, and both have to work to make a household work and go to school and do everything else, right? So you're coming home to your family. You didn't have time to cook, so it's always a fast food option. And sometimes fast food all the time, it is high fat, high calories, and it could negatively affect the child. So remembering that and try to make better choices is what we need to teach our families. There is something on the internet called My Plate, and school age children are a great age to teach. And part of the teaching is how to eat properly. And that is My Plate. It shows them all the food groups and how many they should have. You know, today we know obesity is reaching epidemic proportions, and even the school age children are a part of it. A lot has to do with they're not getting up and getting out and running around outside like they used to years ago, because there's other stuff to occupy their time. You have computers, video games, their iPhones, whatever. They're chronically sitting there in the house, not moving, having a snack, and now they're just gaining weight. Yes, there are some neighborhoods that are unsafe, but most of the time it's because the kids don't have a reason to go outside today. Now, one of the things about overweight children, they can turn into the adolescent and adult that have an increased risk for hypertension, diabetes, high cholesterol, because their body is going through these cardiometabolic changes because they're overweight. So we have learned school age children are a great age to teach. They listen. Remember, they want to please, right? So they do want to listen. They do want to figure those things out. So we need to teach them how to eat better, how to, teach things. I know my kids came home as school age children, and I used to smoke cigarettes. And I smoked quite a bit of cigarettes, maybe a pack and a half, 2 packs a day for a long time. And they come home and they would pull it out of my mouth and break it. They say, "You're not supposed to smoke, mommy. It's not good for you." Well, I want to tell you, 2 weeks ago, it was my anniversary of 15 years, not even a puff on a cigarette. I put them down one day and I was done with them. But my kids, if they would have taught me, I would have had another 10 years on that, right? But it's okay. School age children are good to teach. Now, how do we start preventing, before they become school age, before they become this, school age child who is overweight? Well, we should prevent it in when you're pregnant, and then infancy. Remember, it follows up. Why do you think we do height and weight on all children? And we're looking to see, are they too much or too little? Because nutrition can go both ways. Remember, those lifestyle interventions should target all ethnic groups, because all ethnic groups have children with the potential of being overweight. And we know one of the things that we do is you sit your children down to eat, and you tell them they can't get up till they finish the whole plate. Now, there's other ways to go about it, but what they're taught from school age, usually, or even toddler preschool, is that you have to finish your plate before you get up. And as adults, what are we going to do? We're going to finish our plate. And what could that lead to? That could lead to being an overweight person, right? So we shouldn't do that. Sleep and rest. Children that are school age, when they're 6 years old, it's going to be hard putting them to bed. When they get a little bit older, they're going to be tired. I'm going to bed. There's no more. I need another drink. I need to kiss mommy. I need to kiss daddy again. I have to go to the bathroom again. Whatever. You're not going to hear that with the older children. They will go to bed. And they actually need about 9 to 11 hours. Sports, it's just like being in any of those type of activities. There is a lot of controversy. There is a lot of physical stuff that we have to worry about. I mean, part of your discussion question, how about protective equipment? How about the bullying that goes on? Have you ever gone to a soccer game or baseball game of school age children? Have you ever heard what the other parents are doing to your child? It's one thing, I mean, in Miami, oh my gosh, oh my goodness, it's incredible what you hear. So to be there and to be available for those emotional needs, because those kids can't, many of them, understand why they're yelling at them like that. And it is a bullying. Now, the one thing about any sports, kids love to compete. They love to win. In anything, they love to win. Dental health. Well, we know at 6, it's going to start the baby teeth coming out. We know those permanent teeth are coming in, and we really need to protect them. So good dental hygiene. They should, a minimum, they should brush their teeth before going to bed. So get all that extra sugar and stuff off so they have good teeth. Now, flossing is great, but the younger kids, 6, 7 years old, 5 to 7, and anybody else, they don't have that ability to do that flossing unless you do it for them. So remember that the dexterity they don't have, but brushing their teeth is what they need to do. If a kid starts losing teeth, and these are the permanent teeth, we know this is poor dental care, whether it's not brushing them or getting to the dentist for, checkups. We need to prevent those dental caries, that good brushing as we can. The periodontal disease happens. Kids malocclusion, they're going to need braces. Some of them are due to sucking that thumb, past those permanent teeth coming in. We would hope that that finger comes out of the mouth before those permanent teeth come in. We would hope. And then dental injury, dental avulsion. What happens? And I've seen, I can't even tell you how many, usually front teeth, right or left, don't matter. They come down on in a playground or on the side of a pool, and their whole teeth, root and all, comes out. They're permanent tooth. You're like, oh my goodness. And there's this gaping hole, where that tooth used to be. All I can think of is dollar signs, putting a post, getting a tooth in there. All what I have to go through with my child to get that done. I don't want it. Now, what can you do instead? If you take that tooth and put it in cold milk, bring it to a pediatric dentist or a emergency room that has pediatric dentists, they can numb the area with this numbing gel. They make sure it's good and numb, and they literally push it back up in there, and it reattaches. I've never heard a kid cry when they're pushing it up there. They say, I'm going to be pushing hard. Tell me if it hurts. It never hurts. And then they put them on a soft diet, and they're followed up with dentistry, and most of those teeth catch. If they've done it, the cold milk, bring it and get it inserted as quick as possible. Somehow I don't know, the calcium, I don't know, protects that tooth. I don't know why, but it works. Sex education, they're starting to explore a little bit here, so that it is a lot of curiosity going on. Remember, it's not talking about sex, it's finding out what they know and then answering those questions. Girls at the ender part, like by 10, should have an understanding of menstruation and their period and what they're going to see. And that's a lot to do with that school nurse going on there, right? Having an effective communication with parents would be great. Now, I had 6 brothers. My mother didn't talk to me. She signed that permission slip. I went, saw this film from 1950. It had something I had no clue. They showed this uterus and ovaries and eggs going, and I had no clue it meant I'm going to bleed. I had no clue. So can you imagine, you wake up one day, thank goodness my best friend 2 weeks before me, she got hers the first time and told me. I didn't know. And when I told my mommy, you know what I said? Mommy, I'm menstruating. And she took me upstairs, gave me a box, told me to read the instructions and close the door. Not that she didn't care, but she just didn't deal with that stuff. She didn't talk about it, okay? So when you don't have mommy to talk to, who do we have? School nurses. That's why being a school nurse can be so much fun, teaching these girls and boys about all of these things that are going on, right? So nurses' role, again, very important. Again, there's a difference between having sex and sexuality. Sexuality are your changes, that you go through. And sex is the act of sex. Again, trying to have that communication with them and then letting the parents know what's going on. And of course, always you're talking, anything you give, sometimes oral and written information is important. Being a school nurse, I think if I do it over again, I think I'd like to do it for the reason I'd be off every day my kids were, most of them. I'd have those long summers if I wanted, and I could just do agency somewhere, right? If I needed a couple days. And then Christmas, I'd be off their time with them. But what do school nurses do? I think when it really came to light and really made me to think even more was when COVID came out. And those school nurses had to be proactive in how to take care of those children, right? And they had to follow all the things from the CDC. So it was a big responsibility being a school nurse at that time. And even today, with what's going on, they have to be able to educate, they have to communicate what's going on, and they have to counsel if they need to. And that communicable disease control is huge. I know many times we'd have kids with bacterial meningitis, and we let that school know. And then the school nurse would send out a flyer. If your child was in contact with, make sure that they get a prophylactic antibiotic type thing. And then following up, making sure that that went on. So school nurses do have a big responsibility. Now, school age children, injury prevention. These kids are active, and they're not always in front of you anymore. They're somewhere else in the backyard, in a field somewhere, somebody else's house. Is just being a school age child. But the one that will always be the most common is motor vehicles, whether you're in it or ran over by it, okay? Injury prevention, one of those risks is a stressful family environment. If a kid is in that stressful family, they're going to do risky behavior because they're angry. And it's just what a child will do. So remember that stressful family environment. They should be in the rear seat till they're 13. They should be in a booster seat till age 8. And I live in Homestead, Florida, and the Everglades are like 4 miles that way. And ATVs are all over the place. It's a commonplace thing for all these teenagers to have ATVs. It is not recommended for children under 16 to be in an ATV. They don't have the maturity to handle situations because they're not going to be in your sight. It's a motor on a vehicle and they're gone and you're not going to know where they are. So making sure they're over 16, hopefully, will have more knowledge to take care of any situations. Always use proper safety equipment, and trampolines, they should never be used, believe it or not. It's the highest injury for all school age children there. I've never had one in my house. I never would because of that reason. Seen kids come in, breaking their legs, falling off, injuring their necks, and I could go on and on. So school age, as I said, you've got a kid who was home way a little bit in preschool, now kindergarten, the days are getting longer, and as they get older, the school days are longer. There's another environment influencing your child, but the parents need to be around very unobtrusively, as in secretly you are watching, making sure those children are going to be safe because they need to do this because what happens when they go to college? What happens when they move out when they're 18 and do what they want, right? So they have to be able to learn how to deal with situations by themselves, but mom still needs to be there watching and dad. ADHD is a big thing, school age children. That's the kid who can't sit in the chair, who's always disrupting the class. And we know it has to do with inattention. They go from this to this to this and finish nothing. And they can be very disruptive. So many times the teacher will send them to the school nurse. So here's a school nurse again dealing with this child who can't sit and can't focus and can't pay attention. They're very inattentive. So you call in the parents. Now, many people, nurses, would think, well, this kid's just spoiled, doesn't want to listen. Probably mommy lets them do anything they want at home. That could be something they think of. Never assume. Find out first. Listen, what have they done to help their child deal with this hyperactivity? Many of them have done a lot of things already that you don't know about. Many of their things have been taken away from them. All that fun stuff, the video games, the bicycle, the phone, the TV. but the kid is still very hyperactive. So once you learn what the parents have been doing, then together you can make a plan of care that could be workable. Maybe you have different ideas of what you should do. So that child has that knocked out tooth. The parents are reluctant to try to implant the tooth. I wouldn't even do it. Where should that tooth be placed for transport?
In milk.
You said
In
cold milk.
cold milk, and I have no
Cold milk?
reason why, but yes, it is. All right, adolescents. I was a single parent raising adolescents, 17 months apart. My son was older and I had a daughter younger. So it was a heck of a time, and I call it the time of a roller coaster. You hold on tight because it's going to go up and down and up and down. But the one thing before I start, I'll let you know, my daughter is now my best friend, and so is my son. And they tell me everything about everything, and all of that, I hate you, you don't understand, mom, has disappeared into a lot of, I don't know how you did it, mom, you were great. So again, let's go into adolescence. We know it's characterized rapid cognitive, physical, social, emotional maturation. They come into it as school age children. And then remember, they're going to go through that pre-adolescent growth spurt. And they're going to be getting all these secondary sex characteristics and all these hormones. And oh my goodness. And it ends about 18 to 20 when all of this growing, et cetera, stops. So we know the primary has to do with reproduction, but the secondary sex characteristics are different things. I mean, sometimes we know hormones are going to be there like crazy. A lot of times you'll say, yeah, she's on her period, she's hormonal. We hear that all the time. Or she needs her chocolate. We hear that too. But you're going to hear voices change. You're going to see hair growing in all different places. Girls start with breast buds formation. And now they're starting to get these little rounded figures. And we know secondary has nothing to do with having a baby reproduction. Now, NUR has a scale that you need to know, and you're going to see 5 stages. It's something that you'll be asked, whether it's on exams, HESIs, NCLEX. They love Tanners, just to let you know. So become familiar with it. So boys, the first thing that you see is testicular enlargement. And girls, all of a sudden you see little breast buds. Now, one of the things about girls in the very beginning, remember this, about age 12. So we start about age 10, and then about 12 is when puberty starts, okay? So, you have that menstruation, that's going. So you're full of that, puberty has gone by. Now, during this time, you're just in the beginning of being an adolescent. You're going to have these irregular menstrual periods. That's like what many parents will say, keep track of when you have them, X this calendar so you can keep track of it. We know that they're gaining weight like crazy and height. This is 25% of their total height is going to be done in about 2 to 3 years about right now during that pre-adolescent growth spurt. And they're really, really, really moody, okay? So when the puberty starts, we know menstruation is going to be about 2 years later. The other thing we know about adolescents, boys and girls, is they should be getting that HPV virus vaccine. It's HPV for the papillomavirus, or HBV, which is your hepatitis B, if they haven't gotten it as children. So boys and girls can get it, and about age 12 that should be done. This is your Tanners. This is what you should look at, something you should know, come familiar with it. It just shows you how your body changes as you get to the point of being a grown-up and have all the proper body parts of that adult. As I said, that adolescent growth spurt is in the beginning of your adolescence. It's 20 to 25% of your total height. Remember, height comes with weight. And it's in 2 to 3 years. So it's quite a bit. They say that obesity can happen in early menarche in girls, part of hormonal stuff going on. Obesity with boys, not really. And we know voice changes in both sex. I mean, if you were that high soprano, you could be an one of those altos by the end, or tenor, because your voices get deeper and deeper. And that's common in girls too. Now, Erickson talks about a sense of identity. Well, what is an identity? Well, number one, it's your body image. What do I look like? And no kid likes their body. I'm too fat, I'm too skinny, too many freckles, too much curls, not enough curls, hair's too short, too many pimples, whatever it is. They don't like themselves. So that's the first thing they have to deal with. Then, what do they want to be when they grow up? Have you decided? And then your sexual identity. Do I like girls? Do I like boys? Who do I like? And that's part of that growing up, and it's very emotional. You're all of a sudden have to grow up in your mind and think of these things that you really didn't think, earlier in your life about. One of the things we see in adolescence is a lot of depression due to all of this emotionality that's going on, their body changes, their images that they don't like. And it is said that early warning signs like sleep disturbance, being really irritable, changing appetite, too much, too little, not going out anymore, or even just talking about death, I'd be better dead. Take it seriously, because adolescents, one of the things on their death rate is high on depression, because with suicide, because of all of these things. I mean, we don't think it's a lot, but these children think it's the end of the world. Their social development, they're starting to identify themselves away from their parents. They're trying to find a peer group to fit in and get acceptance. And we know that maybe they'll try this and not be happy and go here. They're looking for their identity, okay? And it is an intense sociability and an intense loneliness. Remember, there's a lot of hormones, especially girls and boys, doesn't matter. But let's say you have a best friend and you tell them you like a boy, and then you come around the corner a couple days later and your best friend is hugging this boy that you liked. You've lost the best friend and you've lost the guy that you sort of liked. Now it's intense loneliness. And before that, you were out all over the place with your best friend because it's a part of your peers, right? So this is what I'm saying, intense loneliness with that sociability. Parents, they don't want parents. They want to do what they want, but they want to say, give me $20 to go out or give me the car keys. But this is just part of that relationship. It is a lot of turmoil and ambiguity. I mean, these children want mom and dad. They love mom and dad, but they don't want them to tell them when and how to do things. So what we see is a struggle between privileges and their responsibility. You'll see those major conflicts of being independent and controlling, their responsibilities. And the problem with that is mom and dad and the child have different ideas of what that means. So what should be encouraged? As a nurse, tell them, sit down with, the parents, with the child, and talk about, get a mean of what is agreeable to both. Because if not, the kid's going this way and the parents is going to be butting heads the whole way. And it can become quite an uncomfortable time of life. Peer groups give them a sense of belonging and feeling of strength and power, and it helps them being more dependent and autonomous away from that family. Personal friends are now same sex, but you do have opposite sex friends at this point, very important. And we know that best friends as an adolescent, the way you treat them is usually how you're going to treat your significant partner for life. So if you weren't good to your friend, probably not too good to your relationship, okay? So it's been said. Now, how do you talk to these adolescents? They don't want to talk to mom. Remember, you're an authoritative figure, and like me, I was older, so why do they want to talk to me too, right? Well, you got to build a rapport. And how do you build a rapport with a child who's an adolescent? Because they don't want to listen to nobody. Well, a lot of times they'll come in, they'll have earbuds in and they're playing music and they're just not paying attention, because mom made me come in, for whatever reason. I'll ask them, so what music you listen to? And the funny thing is many times I knew the groups or who was singing and I would talk to them about it. And they're like, now that sparks some interest, right? Another thing we can do is to observe this child and see if there's any clues to who their personality is. You'll see sometimes girls come in more in male type clothes, shorter hair, etc., which is fine. Well, what if her name on the chart is Rachel? So I'll say, so what would you like me to call you? Because this is an important question. You are giving them the chance to have an identity. And they might say, could you call me Ray, please? You know something? I've just opened up the world because I have given her a chance to be herself, aren't I? I've done that. Or you talk about school or colleges or whatever you can to try to do that. We know sometimes parents are not the person that a child can talk to. Again, school nurse is always a great resource here. As I said, HPV virus, HBV virus for girls and boys that can go. We know that nutrition, kids that are adolescents tend to get a bottle of water and some sort of power bar and go because they don't have time, they're busy, and they're not eating properly, or they're eating a lot of fast foods and they're gaining weight. So sometimes you run into some problems due to poor nutrition. One of the things we can do is do a 24-hour diary. Find out what are they eating and make suggestions for that. Adolescents should sleep a lot. Remember I just told you they went through that adolescent growth spurt. 20 to 25% of their height is going to be in those 2 to 3 years. They should be resting to do and eat properly to grow properly. But are they? Probably not. Why? Well, these kids are on the phones, they're texting, they are watching TV on the computers, or they have schoolwork that has to get done and they're not sleeping. So they're not sleeping the way they should. I mean, it should be stressed to get as much sleep as they can, but we know adolescents really don't. They need some sort of exercise and always to take care of their teeth. Sexuality, I mean, it's all over the place. I mean, TV today, what they show is incredible. Back in the late 50s, early 60s with I Love Lucy, they showed a bedroom with 2 twin beds. And that was like, oh my God, they showed a bedroom with a married couple with 2 single beds. It was like this big news back then. Well, today, we see a lot more in a single bed, don't we? With half naked people on TV. That is just the changes. And these children now are seeing this earlier and earlier. Is it better? Is it worse? I don't know. I sometimes knowledge is better, and then you could talk to someone about it, instead of 2 single beds. I mean, really. How do we get factual information? Well, parents, well, it wasn't mine, but I did have school nurses. And there was a Planned Parenthood as I got older that was in the neighborhood if I needed something else at some, avenue that I could go to. Safety promotion, always motor vehicles. But now these kids are driving. So now you have a child, it's either in the car, under the car, or driving a car. So it is a lot of things to think about. They have less of a fear of stuff. They think they can handle things. Where they're younger, they wouldn't pick up, guns, and now they're going off. So, you're having a lot of firearm deaths because of that. Sports injuries, they tend to want to do the best and they force themselves. They don't warm up right, don't have the equipment, and then you're having all of these injuries going on. And that's all a part of your adolescence. So, age 14, that's the beginning of your adolescence. He seems to be always eating, although his weight is appropriate for his height. The best explanation for this is what? Remember, 14 is the beginning of adolescence. We're going through that growth spurt, right? It's normal. They're getting taller. He has to feed that body to get taller, and that's why he does that. So, any questions so far? All right, who wants to win a Kahoots today? Nobody? Come on, hand. I do. Okay, thank you.
I'm almost on there.
Hold on,
Okey-doke.
what is it? Is it Kahoot it? Which one is it?
Okay, do you see that little Q code there?
Yeah.
Put it on your camera, click it, go right to there.
Oh, okay.
I just found that out after 5 years of using this game. One of my students in my Friday class said, all you have to do is click on it. I went, what? I didn't even know it was there.
Oh, yeah, hold on, wait a minute. It ain't doing it with my camera. What's the website? It's Kahoot.
Kahoot.it.
Right.
You good?
Yeah, I should be good now.
All right, let's get going. And here we are. Week 3, school age and adolescent children. How does the onset of pubertal growth spurt compare in girls and boys? Remember I told you boys were stupid? And it's all because we tend to grow up and get those hormones, or we're forced to. Now you're a grown-up. You must act like a grown-up girl, like a woman. That's what my mommy taught me. So it's about 2 years before boys. A multi. What activities are appropriate for a 6-year-old child? Remember when we talk about industry and doing things well, we don't want to offer something to a child that they may not be able to accomplish, because that will cause frustration, because industry makes them feel good, accomplished, they did it. So organized sports, not quite yet. They don't think it's ready yet. They can't play a card game yet. Most of them don't understand it, but they can ride a bike. They can jump some rope. They can play hopscotch. At what age should a parent expect to have major conflicts over independence and control with their child? Gee, what age would that be? My favorite roller coaster age. And that's 15 to 17. They're over that beginning hormonal period. They grow, they're starting to fit in where they want. Now they want to get out and go with their peers that they figured out. And that's about ages 15 to 17. So the signs of onset of puberty in girls, what does it start with? And this is what Tanner says. And that's the breast buds. That's the first thing that happens. And this, again, is according to Tanner. That's the scale that you need to know. The onset of puberty in boys is characterized by again, what's first? And it starts with testicular enlargement. Again, it's Tanner, and he says the testicles start to get bigger. What do we use to determine if a female has reached the age of monarch? You see all these physical signs. What can you look at to say, all right, where are we within this? And that's Tanner staging. There's stages 1 through 5. Where are you? Are you at the beginning, the middle, or are you at the end? Are these changes just about done? A child goes to the ER with a low fever, pruritic rashes, and open oozing papules. Nursing care. What do you think that could be? This is an infection control question. It's about children. I've seen it all the time. You start seeing a child coming in with a rash, especially when you see open oozing papules, and you usually will see them at all stages of healing, from crusted over to maybe oozing still, or maybe a dry ooze. That is probably chickenpox. Chickenpox is airborne, varicella. And even though these children have had these immunizations, they still can get it. I've seen many cases of it. Now, I can tell you one thing. I've never gotten an infection from a child in the ER. In 10 years, I never had strep throat, never got the flu, and I never got anything like chickenpox, all because I could see the signs. Protect yourself. Okay? If you're not protected, you're not going to be there to take care of the kids. A source of injury, whether intentional or unintentional in adolescence, is associated with what? Safety. What did I tell you? Is all age groups. Doesn't matter. Motor vehicles are it. Again, they're driving it now. They're still being run over because they're hanging on, falling off, all of these things. Adolescents tend to do some crazy stuff. If a parent feels uncomfortable talking about sex education, who could be a good resource? And it's your school nurse. Very good. A 9-year-old friend tells him soccer is a dumb game and he should play baseball. Why is he saying that? What is that all about? So we know that this 9-year-old, the big thing is peer acceptance, and they will change what they're doing just to be with their peer, because that is more important than their want to do whatever other sport there's there. During admission, the father of a 16-year-old says, "We're Buddhist. Culturally competent care includes when someone's different from a culture than how do you take care of them?" Right? And you should ask if there's any preferences. Now, a 16-year-old, you can ask the child too, what do you want? Many times it has to do with undressing, could be food, diet, could be only vegetarian. It could be allowing prayer times. All of these things are important to that culture. And if we don't know, how do we find out? We ask them, the parent and the 16-year-old child, what do you need from me to help you take care of you? What do you have? I don't understand. I don't know. And they'll absolutely appreciate it and will actually respect you for saying that. When teaching sex education and contraceptives for adolescents, what should the nurse consider? So when we're talking about sex education and contraceptive, I mean, we cannot put our opinions out there. We could say you should be abstinent, you shouldn't be having sex. And adolescents going to do what they want. So how do we take care of this? Well, we give them education. We tell them just education, not our feelings, and to give it to them in some sort of written form. And then they can make their own decisions what they want to do. Okay? Multi. The management of adolescent obesity should include what? Remember I told you this is the age where they're really not eating right for whatever reason. They're just too busy. They're always out of the house. They're always on the go. But when you're talking about adolescent obesity, number one, you need to find out what they eat on a daily basis. So at least getting that 24-hour diary will work. Also, you need to give them a reward. You know, adolescents want that reward, whether it is, you know, changing the type of food to a low fat from a real fat, like ice cream or something. Maybe that is the reward. Diversion is not used for adolescents. That's your younger kids. Diversion is great for young kids. And using a nutritious food as a method of reward. Yeah, let me have some carrots. I'd really like that. That's a great reward. No, we don't use that either. Infants go through predictable sequence of growth and development. This is called what? I'll always throw in some questions from another week. And sequential growth is sequential trends. You know, I think that you're like, well, it couldn't be sequential because it's in the question. So it couldn't be in the answer. Do not overthink that. It does happen in a sequence, okay? So don't overread questions. I put that one there just for that purpose. Which benchmark serves as the ending period for school-age children? Or at 12-year-old, what do you expect? We know it begins with the losing of your deciduous teeth. Your baby teeth are gone. In the end, you have your permanent teeth, and it's the onset of puberty. Wisdom teeth, you know, they can happen at any time. Some get it at 18, 20, so that has nothing to do with permanent teeth. Which action would improve dental health in the school-age child? You know, if they can floss is what we want them to do. And if when they're able, remember, young kids, first graders, maybe even second graders don't have that manual dexterity to do that yet. They're getting those cute little sticks now. Generally, the earliest age at which puberty begins is? I think my comment about boys being stupid at that age really helps remembering those ages. 10 in girls and 12 in boys. That's good old fifth grade. I remember it well. I wish I could forget. An 8-year-old child says she has cancer because God is punishing her for being bad. Why is she saying that? And it's right at that age where I would sit down with them before they had surgery or something to let them know they're not being bad, because it is an extremely common belief at that time. Okay, it's nothing to do with religion. Doesn't matter what your religion is, whatever your name of your God is, okay, but it's common. They believe I do something wrong, something bad's going to happen to me. How they get that, I don't know. A 6-year-old needs a chest x-ray. What explanation is the best? The technician will use a large camera to take a picture to look inside. And when you come back to your room, I'm going to let you see the picture. They're going to be so happy. How do you get an adolescent to open up about their sexual history? I mean, many of these adolescents really don't want to talk about it, especially if they're less than 18 and you got parents in those rooms. They don't really want to do that, do they? But you're going to try to open up, get on their developmental level in an adolescent way, right? And then the other thing we can do, ask the parents to leave the room. And the child, if we've already broken open, this rapport, they give them that chance to open up and express themselves about whatever's going on. Be prepared. They're going to tell you some things that will shock you. Don't look shocked if you possibly can, but it will happen. But, again, getting on the rapport, getting the parents out, they'll tell you a lot of things. The only thing about that, you don't have to tell the parents what happened, unless it's something that would hurt them or others, okay? But just telling that they're having sex, I don't have to tell the parents that, okay? All I need to tell them if they're in harm's way. How do you get an adolescent to be more receptive to talking about health and sexual exploration? Again, get the parents out of the room, right? Would you talk in front of your parents about sex if you were 16 years old? Oh, no way. And they're gonna beat you up, put you on lockdown, and you're never getting out of the house. Yeah, me too. I understand. A multi-select. When educating adolescents about the risk for HIV and hepatitis, what would you include? I mean, we know the one thing we're going to say is you shouldn't be. But they're going to say, yeah, but I am anyway. So abstinence, you can ask or you can say, it doesn't mean they're going to follow it, but at least using some condoms, and actually hand washing is another way. And I hope they're taking more than 1 week, 1 shower. I hope it's more than that because they're greasy and, oh, please. That was my son. Get in the shower, will you? A child is knocked out tooth. Where should the tooth be placed for transport? You all know this one. In that cold milk. And something, as nurses, and as parents, the other parents know something like that happens, put in milk, get to the ER, call pediatric dentist, right? Save that tooth, save a lot of money in dental repair. A nurse planning for a school-age child should know what thought process is seen. Thought. How do they see things? How do they figure things out? What do they know how to figure out? And this is the word I don't like. And that's that ability to conserve, right? The glass, tall or short, it's the same amount, or it's those pennies in all different directions. Magical thinking and animism is more of your preschooler. And thoughts are all powerful. I don't know if they get there until they're adolescents, and then they think they are. What stage of Erickson would you use for a school-age child? What do we know about school age, and what do we tell what Erickson says? Industry, what can I do well? What task can I do good? And I do these things great, but I can't swim. I feel inferior, right? What do I do well and what I can't? Mistrust and trust is infants. When I scream, somebody comes for me. Initiative versus guilt is your preschooler. They want to do stuff for you, but feel guilty for different things, okay? Autonomy, me, autonomous, all about me, I, me, toddlers. And then the parents' inability to let them do things. No, please don't do that. You get hurt. Watch out. Do that. Don't let them try. They need to try and be autonomous. School-age children's moral development. It's all about Kohlberg. And remember Kohlberg, the way he talks about moral development, it starts as the younger kids are all about doing right or wrong and a consequence. But as they get to be school age, they want to do good. They want to do right. They want to please. Okay, it's a change. So that's the answer there. Kohlberg, wanting to please. A multi. Anorexia nervosa is characterized by. This was part of the reading. I'm just putting a couple cahoots here. I don't go into it in depth. We know it's, an eating disorder. I mean, the picture tells 1,000 stories, doesn't it? So there's two types of eating disorders, anorexia nervosa and bulimia, and they're different. Anorexia, just like, bulimia, both are afraid of a fear of weight gain and an unrealistic body image. The difference, anorexia doesn't eat at all. Maybe water and maybe a leaf of lettuce. And they're afraid it was too many calories, okay? And then you have the other one where they eat, binge, and then they vomit, okay? How would you know the difference? You got two skinny looking, there's an eating disorder on these adolescents. How would you know the difference? Look at their teeth. If you're vomiting, what's going to happen? Gastric acid, it's going to burn the teeth. They're going to have rotten teeth. That's what you'll see. So how do you know if you suffer from bulimia? And again, that's the binge eating and purging. And of course, you're going to see the teeth if it's gone on for a while. Adolescents are. They're stuck somewhere between childhood and adulthood, and they're confused, troubled, frustrated. They're looking for identity and they're depressed. I mean, it's just part of what they are because they're going from being a kid, now have to grow up and figure out what they want to be when they grow up. What is an adolescent's heart rate? I gave you this thing for you to look at to show you there are differences. I just threw this one in here to show you, what is the change from that neonatal period, 140 to 160 heart rate up to an adolescent. Now, where would you see it? And usually you're going to see it 55 to 90 because they're more active. So the heart rate's slightly lower. Now, if my heart rate was 120 as an adolescent, I'm either just stopped running, I have a fever or I'm dehydrated. 120 is too high. When talking with an adolescent regarding personal health concerns, which is most important? Again, let them talk about whatever they want to talk with. Let them express themselves. You may be the only person that's going to give them proper advice. So please just let them just lay it all out. Hopefully with no parent in the room, because then they'll talk more. A parent says their infant puts everything in their mouth. Based on Freud's theory, how would you respond? Again, another question from another day. What did I tell you about the mouth and infants? Infants explore the world in their mouth and it just makes them happy. They find their finger and they suck on it, and or have a pacifier, or even up 4 or 5 years old, they're sticking things in their mouth. It's just the way that children explore the world. A multi. What could be a sign of potential child abuse? Now, as a pediatric nurse practitioner, you are in any area of pediatrics, you always should be at a out for potential child abuse. I've seen some extremely bad cases of it, and you think these things aren't happening today, and they are. The one thing you need to look at, and it's sometimes the clue, is when they tell you something and what you see in the injuries, they don't match. Or that kid's in the corner, afraid to talk, always looking at mommy like, what should I say, mommy? Okay, or daddy, whoever, aunt, uncle, grandma, grandpa, whatever. And then again, if you get them separated, they're going to be different stories. You fell at the playground or did you fall down the stairs? I mean, there's going to be differences, and they will be caught by those, wrong stories. Remember, though, if a kid comes in and they're hurt, parents are going to be concerned, whether most of the time that when they're not abused, right? So always remember the parent, with this going on, that the kid got injured, especially if it's to like a sexual abuse that went on. Those parents are going to suffer, especially if it's somebody out of the family, whatever, it's not them. So always remember parents. Parents, they go through a lot with these children too. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are what? It's homicide and suicide. Those firearms, they're going to be around, okay? And then we will always worry about suicide because of body image in these children. In school age, conflict of industry versus inferiority. What does industry mean? School age. What is an industry? Remember, this is mastering a task. What do you do well? Some kids are good at spelling. Some kids are good at hitting a ball in baseball. And some kids can't, do something. They're going to feel inferior. Industry, I do it well. Makes me feel great. Inferiority, I can't do it. And I feel inferior to you because I can't do that. Which age group prefers to be with members of their own sex? And that's your 7 to 11-year-old. You know, the beginning of school age, they're still not into those same-sex peers, but as they get a little bit older, yeah, then that's where they start. Again, same-sex peers, according to Freud. True or false? Home support is invaluable to the adolescent. Do they really need mom and dad? Do they need mom and dad to be there for them? As much as they don't like them? And they do, actually. What happens if something happens on the outside? Who is that adolescent going to go to? They need mom and dad to be there. And that's the reason why that's important. Home support is always invaluable, whether they know it or not. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? What don't you see? And that's the decaying teeth is bulimia. Why? They're vomiting. Gastric juices eat their teeth. A 14-year-old is in the emergency after a biking accident. How should the nurse interact with this adolescent? You know, I was a primary nurse on the trauma team for many, many years, and I'd be the one in charge of the child and making sure everything was going in the right manner. And what was my main goal there? I'm going to tell them what's going on. You know, all of a sudden you have ER doctors coming at you, surgeons coming at you, neurologists coming at you, chest x-rays, people drawing labs, starting IVs, and it is scary. So giving them that clear explanations and let them ask questions about what's going on. It'll help it go easier. And then the child and adolescent at this point, they're just scared, you know, because they're in an emergency room. Something just bad just happened. Cooperative play, what is it? Cooperative play, it means here's the toys, let's build a castle and let's do it together. And when we're done, we'll put the flag on. There is a common goal. It could be a board game like checkers, right? Same thing. Associative play is they're playing together, doing all the same toys, but there's nothing that they make from it. They do their own little thing. Cooperative, they cooperate together. They make what they want together. What does moral development involve? Who talks about moral and morality? Which theorist, right? And what does that theorist say? And as a child gets older, they're starting to learn right and wrong. There's a consequence for each. So they know what they should do and what they shouldn't do. And that gives them their own morality as they grow. Developmental milestones are important to observe because of what? Why do I need to know when they crawl, they walk, when their teeth come in, if they're hopping, skipping, jumping, talking? Why? Because they could be clues to be needing early intervention and prevention. And as I said, the greatest thing about children, they catch up quick. You give them what they need, and these children turn around and they're caught up to where they need to be quickly, so they're not left behind. Lymph nodes in children with normal findings. Shouldn't be able to feel them. They're healthy. You shouldn't be able to feel them at all. In their neck, their armpits, their groins, nowhere. You don't feel them. Depriving a child of food and clothing and shelter is called what? I watched the news about these kids that were playing in the front yard and the ball went into the street and this car stopped, almost hitting a kid. And the cop came and saw that these children were playing outside in 30-degree weather without coats. These parents were arrested for neglect. They didn't have the proper clothing on, believe it or not. So this is, the definition of neglect. Which of the following immunizations is given in the adolescent age? About age 12, right? And that's your HPV or your HBV, which is your hepatitis B. And it's that 3 series vaccination that should be given. ADHD most likely involves which of the following? And it's all about inattention. They can't pay attention and they're distracted easily and they're here, there, and everywhere and they can't sit still. They got what we call ants in the pants, right? They can't sit. Poor things. Multi-select. An adolescent is brought into the ER with a drug overdose. What are some initial questions that you need to ask? Like, how are you going to care for that adolescent? They're able to talk. What do you need to know? I think this is just like saying, are you on any medication? I want to know if you have any allergies. Okay, now I want to know, what drugs did you take? When did you take them? And how did you take them? And it will plan the care that I need to give that child. Those are your important things. They're not talking rehab right now. They just need to get through this overdose at this point in time. And they're probably upset because mom and dad been called, right? Adolescents typically place blank on peer relationships. Your last question. And it's a very, very high value, more than mom and dad. They want to be accepted by their peers. Very good. All right, number 3. Ashley, good job, Ashley. Number 2. Amber, good job, Amber. Number 1. Sam, good job, Sam. 4, Jeremy and Jess. Good job, guys. It was a good cahoots, had a lot of great questions in it. It covered stuff that was before and some stuff that I can't cover everything on a PowerPoint. So thank you so much for being here, paying attention and getting through it. Does anybody have any questions about anything? Remember next week to come in if you can about quarter till to get you all set up. I want to get you going on the exam by 5 after so that you can go, and then we will have class to follow. I'm going to determine, are we going to do a Kahoots for class or are we going to be doing a PowerPoint? I'm going to share that. I've got 2 RN classes. Somebody gets a PowerPoint, somebody gets a Kahoot. So let's see which one I come up with for you, okay? Anyway, you'll get both of them, both recordings of the PowerPoint and of the Kahoot. So it gives you everything. And you only had to stay here half the time, right? So that's the important part. Well, you all have a great day. Remember, reviews are going on. I'll be posting them. Anyone who needs a one-to-one with me before the exam, please just schedule a time, all right? And I'll be here for you.
I have a question.
Sure.
Oh, I'll ask you in the breakout room.
All right, well, wait till everybody goes.